Okay then, I think everyone's settled. So we're going to go ahead and get started. I'd like you all to give a warm welcome to Dr. Burkham. She is an Iowa native. She got her bachelor's degree from the University of Minnesota and then went on to get her DVM from Iowa State University. She was a small animal practitioner for 8 years, and she's been very involved with the veterinary community. She was co-founder of the Johnson County Animal Response Team. She served 6 years on the board of the Kansas City Veterinary Medical Association. And currently, she's been working at the Mariposa Veterinary Wellness Center, where she handles small animals, exotics, and we're very grateful for her to come and give us a perspective on exotics in private practice. So if you could, please give her a welcome.
Okay, can you hear me okay? All right, I'm so excited to be here. Thank you so much for the invitation to come talk. I love talking exotics, and I love when we have students come through our practice, and so I'm really happy to be here. I hope I put this presentation together. When she asked me to come talk, I thought, okay, you know, what kind of information would I want to hear when I was in vet school? And so I graduated, as she said, from Iowa State University. I graduated vet school in 2004. And I've tried really hard to remember what it felt like to be in your position. You know, there's so much information, but there's also just excitement because, you know, you're learning these things that you have been wanting to learn. So I tried to distill down kind of what I think made it possible when I was in your position, you know, planning to incorporate exotics into my future career. And there were some really key things that I did kind of at your stage, and then also just kind of throughout the years since that time. So I put it together, my top 10 list, and I hope you find it useful. So here's like my kind of my condensed version, and I have tons of pictures too. So like, I'm not sure. I'll try to keep this within the time frame. If I go too fast, I have lots of additional stuff I can go over. Or if I, you know, take too long on any particular area, then I guess, you know, bug me afterwards or send me an email. I forgot to put my email address up here, but I'll give it to you. So here's my list. First and foremost, especially given this, you know, where you're at right now, is externships. Can I see maybe a show of hands of like, who in here are seniors? No one? Okay, juniors? Okay, sophomores? Okay, and first years. Sorry, I guess we don't call them sophomores, do we? Like, first, second, whatever. Thank you, I appreciate that. That just helps me kind of have an idea. And so I'm definitely going to talk a little bit about what I felt were the best parts of my externships. And there's also definitely, I'm going to talk about Evernote, community, you know, finding your niche within the veterinary community, textbooks and resources, like I brought some examples. You're going to meet Francine. And I'll talk about willingness to try things that I've never done before. That is certainly huge, and just a never-ending, you know, when you're in exotics, that's what it's all about. Necropsies for free, about that. I just heard this phrase, emotional dexterity, earlier this week. I'm like, that's perfect. That's exactly what I need to talk about. So I love that phrase, emotional dexterity. The importance of celebrating success. And of course, expect the unexpected. So that's my kind of my condensed list of this is what has made it possible for me to practice in exotics. And I'm really excited to see Dr. Carpenter here. Dr. Carpenter came up to Iowa State for several weekends when I was in vet school, because at Iowa State we don't really have an amazing exotics program like you do here. So I very vividly remember him and some of his colleagues coming up to our school for several weekends. I know that was a big highlight, and so appreciate you coming out to Iowa State. Do you still do that? Go up to Iowa State? Or?
No, once they hired Bianca, then they go.
Of course, Bianca Zafrano, yeah, she's amazing, and so that's true. move through my list. So externships. The big one for me, like I don't think I could have been an exotic animal veterinarian if I didn't do this externship. And it's not so much necessarily the Midwest Bird and Exotic Animal Hospital that made it all possible, but it was a big part of it. So they're located, maybe raise your hand if you've heard of Midwest Bird and Exotic. Like, yeah, a couple. It's just outside of Chicago. They had and this was a while ago, but they had a really nice program and a place for me to live, and it just worked out perfectly. So it's an all exotics practice. They have like, I think, 4 or 5 exam rooms and a surgery suite, and they were always busy, and it just was awesome to see, that they're keeping like 4 full-time exotic doctors busy all the time outside of Chicago. And and that's not the only exotic exclusive practice in that area, so it was pretty awesome. So one of the things that I don't think I put some of my pictures in here, not a whole lot. These are some pictures from Midwest Bird and Exotic. Definitely bring along like a little notebook I just kept in my pocket, and I would just jot down kind of snippets of cases, and absolutely essential. I don't know how you could just go through your day and then at the end of the day just write it all down. Like I felt like I really need to go through during the day and just make notes all throughout the day. We're so busy all the time. So on the left here is a rabbit with syphilis. That's actually the only, I guess I don't see a lot of rabbits with syphilis, so that's kind of my only case that I have seen. And I had some other pictures too that I didn't include in this presentation. And then, some kind of parrot with a horrible beak. And then, a little picture there of the cockatiel. This cockatiel, I think, was either egg-bound or had like some maybe egg yolk coelomyces or something. And so it was pretty awesome for me to watch, that this is in their hands. It's not all that unusual to do a procedure like this. I've attempted a couple of times in practice, but to see like the equipment they have, and it's all scaled for very, very small patients. I mean, you can even see like the little circulating water blanket. If you've seen circulating water blankets before, usually, the ones I have are, big for dogs and cats. But this is just a little mini one. And the little, I think it might even be just like a syringe case that they've adapted onto their anesthetic thing, and just to get a real snug, so there's not as much dead space for the anesthetic gas. And then, the heating and the tape and just all their equipment. It's really awesome to see. So I felt like this externship for me really gave me a solid foundation with exotics. And like I said, I don't think I could have gone into practice without, and I think it was 3 weeks I was there, just seeing all manner of exotics. And just hearing what the doctors have to say about husbandry, and just, kind of hearing all that. And then also I did, I didn't really have any good pictures, so I just put this video on loop. But it's, so it's not very exciting. But the Raptor Center, I did my undergrad at the University of Minnesota, and when I was at the U, I spent 4 years volunteering at the Raptor Center. And I love raptors and birds. And so it was a natural place for me to do an externship. I think they don't have a place where you can stay necessarily, but I had friends in the area, so it was easy for me to stay up there. And so at the Raptor Center, and again, I've got my little book. They have all manner of eagles and hawks and owls and trumpeter swans and falcons and from far reaches, because the Raptor Center is so well recognized. So if you have any interest in raptors, for sure, this would be a key one to do. And even just birds and potentially orthopedic surgery, because they do a lot of fracture repair. Yes, there's.
Yeah, that's it work here full time?
Yeah.
Or
Yeah, so Dr. Pat Reddig is kind of the founder of the Raptor Center. He's retired now, but Dr. Julie Ponder, she's the executive director of the Raptor Center, and then they have like residents. There's at least 1 to 3 residents at any time, and they're all busy all the time. Yeah, and they have a surprising amount of staff as well. I don't think I actually wrote down like how many birds they have at any one time, and I'm sure it varies, but I mean, they probably easily had, I mean, just in the clinic, and that's excluding like the ones that are outside in the rehab pens, 50 birds at any time. I mean, they've got a lot. It's awesome. So I picked up a lot of information there. I think those were my memory is fading. I'm pretty sure those were my 2 main exotic externships. And I suppose if there was another one that didn't make much of an impression on me. So those are good ones. Okay, I get to talk about one of my favorite topics. And it has nothing directly to do with veterinary medicine, but it is my life. So, and I say Evernote, but I think you can understand that it doesn't have to be Evernote. There are other similar programs. This is just a note-taking app. And so I've got it on all of my computers. I've got it on my phone, on my tablets, anywhere, and I can access it anywhere I go. I have learned, and I've been an Evernote user probably, I don't know, maybe about 10 years, but I have found that over the past maybe 5 years especially, the more I use it, the more I use it. And I absolutely cannot live without it now. So I just encourage you to find a way that you can save notes that is easy for you to search and find later, because it's one thing to have it in your email, or maybe save a Word document on your computer, or maybe you have the conference proceedings on, maybe in the cloud, but if you have it in an app that you can easily search. And so, for example, I saved a little screenshot, not that you can probably really read much of it, but if I type in, my little search field, bunny magic, so I use bunny magic for sedating rabbits, and I don't have those doses memorized, I just never have. So if I type in bunny magic, my 2 little notes pop up here, but then there's the note on the right-hand side. And I used to use dexdomitor and ketamine. Not so long ago, I had a bunny die after giving that. It was a totally healthy rabbit neuter. There was no reason for it to die other than I would just presume respiratory suppression. And we didn't have it intubated, which I don't intubate all my rabbit procedures. And even if I did routinely intubate them, I think this happened so quickly. I don't know what I could have done differently, honestly, because we were watching him really closely. We were getting him ready, going to prep him for surgery, and one moment he was breathing, the next moment he wasn't. Couldn't intubate him, just lost him that quickly. So I know, even though I've done like probably hundreds of rabbits with that combination, when you have one die very unexpectedly, it kind of makes you a little gun shy. So I've moved away from dexdomitor and ketamine in rabbits, and then I have my little note there, I don't know if you can see it, but from Mark Kramer. Mark Kramer is another exotic animal vet that I have a lot of respect for. Maybe he doesn't have any published books or anything, but he's a friend and a colleague. So I asked him what he uses. And so he uses ketamine, 7 mg per kg, midazolam, 0.5 mg per kg, butorphanol, 0.5 mg per kg. Mix them all in one syringe and then give that IM. And so those are just my notes. So when I've got a rabbit, I just do my little calculations. And then, just any notes. So I was gonna maybe, if this will work, maybe just pull up Evernote real quick. Here, this is I guess my highlighted note right here is I actually took a picture from, I think it's from this book, about atherosclerosis in birds because, again, the more I use Evernote, the more I use it. So I've trained my brain that if I want to look up something, the first place I search is actually Evernote to see if I've come across it, if I have any notes. Let's see, if I type in another, like Lupron, I've got all my notes related to Lupron, and so maybe I can't remember, dosing information. I've also got my Word document, how to reconstitute Lupron. I've got a separate note, Lupron sources, because Lupron, I don't know, does Lupron mean it? Like, can you raise your hand if you know, like, for the context of Lupron? Okay, well, I don't know, maybe. There are certainly things that have kind of, newer and better in place of Lupron, but anyway, I still use some Lupron, and so, for example, when would I use Lupron? I still use it in ferrets that have adrenal disease, if they're not going to go the route of a implant. There's an implant that you can do it for ferrets to help them with adrenal disease, but Lupron is generally less expensive if you find the right source to purchase it. I feel like I could go do a whole talk on that, so I don't want to get on too much of a tangent. But I think my point is just find a way to save your notes that's easy to search and use it and use it and use it and train yourself. Just if you find some interesting little fact, like what is the age of sexual maturity of guinea pigs, and you want to remember that, you don't want to have to like look it up online necessarily, which you can do that, that's fine, but like just this morning actually I found one of my old I was cleaning out my desk and I found this fantastic little Post-it note with some great guinea pig information. I was like, oh, I need to save that, so I'm going to put it in my, there's guinea pig vitamin C amounts, guinea pig cages, guinea pig toys. When do guinea pigs reach sexual maturity? Just really helpful information. Like, so I don't know how long I've had that little note sitting in my drawer at my desk, but when I read it, I was like, oh, I have to save that, because I could not remember this, but I'll read it to you. I think it's perfect information. So males reach sexual maturity at 3 to 5 weeks. Females can be fertile as early as 4 weeks and carry litters before they are adults. Females that have never given birth commonly develop irreversible fusing of the pubic symphysis, a joint in the pelvis, after 10 months of age. If they become pregnant after this happens, the birth canal will not widen sufficiently and may lead to dystocia and death as they attempt to give birth. And females can become pregnant 6 to 48 hours after giving birth, although that's not recommended. That's not helpful. But I just thought, wow, that's great information. I'm not going to remember that. I'd love to think that I could just keep that in my brain, but it won't stay in my brain. And so now, if I ever forget, I can think, I wonder if I put that in Evernote, and it will be there. So, I guess I'm curious, do you guys have, if anyone would be willing to share with me what are your note-taking systems? I'm just really interested to hear from you.
OneNote.
Which one?
OneNote.
OneNote, yeah.
It's very similar program to this, and
Yeah.
it's already uploaded on our computer, so we can.
Okay, cool, yeah. So because I imagine, I've heard of OneNote and I've never used it, but I imagine it's very similar to Evernote and just having something like that. Any others that you just love? You all pretty much use OneNote. Do you use OneNote though? Use it? Okay, good. Yeah. I just encourage you, and I know we all have different ways of learning and retaining information, but I just find it very worthwhile. Get back to my presentation. It's also really huge, and so this is the Exotic Animal Medicine Club, right? So you don't have separate clubs for avian or reptile. It's all of them. So there's not one veterinary organization that really encompasses them all. You have to join the AAV, the ARAV, the AEMV. So it's the avian group, exotic mammals, reptiles and amphibians. And I highly, especially, if you know you're going to be working with one or all of those, join one or all of those, and then go to the conferences. Actually, I think last year was the first time they kind of combined, well, they kind of dabbled with merging, but last year was kind of the first Exotics Con, which is like all the exotics associations coming together for a conference. And just raise your hand if you got to go, either this year or last year. Yeah, awesome. It's so awesome. I felt like a great way, especially as a student, to get to know some other exotic veterinarians, around the country, because they always have student groups. They really encourage camaraderie among the students, and really even the non-students really enjoy chatting and getting to know the students, and sharing in that excitement and enthusiasm for the profession. So I think make the most of your community, get involved, look for other ways to get involved. Oh my gosh, yes, that was me as a vet student. At the AAV conference, I assisted with one of the wet labs, so it was like I think it was a bird handling wet lab. So we had a little bob white quail. They're very easy to handle, and they don't bite. They're just very easy to handle. So, looking for those opportunities, and a lot of times at those conferences, I can't remember if they paid me or if they gave me like a heavy discount because I helped out with the wet lab, but it's a win-win. And don't be afraid to ask questions. Don't be shy. Just get out there and talk to the other attendees and meet online as well. AEMV, the Association of Exotic Mammal Veterinarians, they have a very active Facebook group. So definitely, get on, if you're not already on Facebook, can find them. You have to make sure, because I think on Facebook, a lot of the associations will have kind of their public Facebook page, and that's different. You want to find the group, and it's usually, like you have to request permission. And but there's some good, I find, so I was going to mention VIN too, like, do you guys know VIN? Nod, or, yeah. So definitely take advantage of VIN as much as possible, because is it still free for students? It should be. So VIN is the Veterinary Information Network, and take full advantage of that. Because it costs money after you graduate, not everyone continues their VIN subscription. I have, because it's, I think, well worth it. But I feel like the AEMV Facebook group is kind of like its own little VIN that's just for exotic mammals. And they share interesting cases, and so I find that to be a really helpful resource. And then also I get little notifications when there's interesting cases posted on AEMV. So definitely getting involved with those organizations. I think while I'm on that though, like, get involved. As Sarah had mentioned, I was on the board of the Kansas City Veterinary Medical Association. I highly encourage you, kind of wherever you end up, to get involved with your local VMA, because that's also a great way to, number one, meet other veterinarians, be involved in your profession in a very proactive way. And I feel like we all have, a responsibility to serve our profession, not just our patients and our clients, but serve the profession. And that's a really valuable way to get involved. Textbooks. I brought, I think I brought most of my textbooks that I feel are the ones I use the most. Although truthfully, I don't use like every single book on this table. And so feel free to come like look through them afterwards. The picture I have here, I'm almost embarrassed at, that this, like in terms of how old it is. This one published in 1997. But you can see with all my little tabs, and I didn't even actually bring one of my other avian textbooks because it's kind of big and, a lot of them are just big and cumbersome. I love the size of this one. It just is very practical. I can just really get the information I need. Like if I want to look up feeding formula guidelines, it's just right there. How much should a finch get, or a cockatoo, or a large conure, or a small conure? It just has a lot of really helpful information. So even though that one is, in theory, it's like, I guess going on 20 years old, I still like that one a lot. In fact, this is the current therapy in avian medicine and surgery by Dr. Spear, or edited by Dr. Spear. This just came out the beginning of this year, so I haven't had it, even a whole year. But obviously it's got really current information. I was been waiting for this book for a while. And then just some other books here, of course, the pink book. This is, and when you've got we've probably got book fairs that come and they sell books. Everybody's got to have the pink book, the ferrets, rabbits, and rodents. And of course, I know, and I'm not just saying that because he's here, but the exotic animal formulary, just cannot practice without that. Also, another really great resource, the pain management for veterinary technicians and nurses. This is a fantastic book. Definitely a big advocate of pain management, and there is a lot in here about exotics. And the fact, it means nothing to me that it says for veterinary technicians and nurses, because it's for everybody in the veterinary field. And I think, yes, I got it signed by the author. So. I find this to be one of my most useful books, but it probably reflects more of just how much of a bird nerd I am. I am a huge bird nerd. And so I love studying like the taxonomy of birds and all the different kinds. So this is a guide to parrots of the world. So when I have a parrot species come in and maybe the owner isn't 100% sure what it is, or they're calling it one type of Amazon or cockatoo, and I'm like, no, I'm pretty sure that's something else, I can get out my book and get some information. So I love having that as well. So like I said, feel free to take a look at some of these books. Oh, this one too. This sounds like a really cool book. I don't truthfully use it a whole lot. Holistic Care for Birds, a Manual of Wellness and Healing. This is by Dr. McCluggage. And I don't use a whole lot in here, although the practice I'm at, Mariposa Veterinary Wellness Center, we have a whole herbal pharmacy. We have a lot of very kind of non-traditional tools available to us. And I've dabbled a little bit in like some essential oil use for birds and some other species. In fact, this little photocopy here, which I do not have in Evernote. I need to put it in Evernote, because if I ever lose this, then I'm really screwed. But this has some medicinal herbs for use in rabbits, and so just kind of some other interesting things. Because a lot, and I don't know how, I'm guessing you probably don't get a whole lot of lectures or training in like kind of non-traditional therapies, but there is definitely, and maybe it's just because of the practice where I'm at, but honestly, I feel like there's such an interest in it from our clients. The clients are interested in non-conventional therapies, and for right or wrong, and steering them in the right direction is part of our responsibility. But I think having some background and understanding of what is out there and what's safe and what could potentially be helpful are good to know. So actually, I'd be happy to talk more about that if you want me to towards the end. Oh, there's some more pictures. I think that was before I decided to just bring all my books. Okay, I would like to introduce you to Francine. I had to name Francine because it's just too cumbersome to say, could you go get me my surgical magnifying lighted head loops? So this is Francine, and I could not practice without her. Sorry, right next to the microphone there. On there. So, get my battery. I feel so at home with her on. This is how I go about my whole day, pretty much. So it's got its own, okay, I'll turn the light off so I don't blind you. You get the idea. So it's got its own light source, which you can move. And then it's got the magnification. And these are custom fit for my eyes. And so these are, let me go to the next page where I kind of list some information. Try not to get my microphone. So these are from Designs for Vision. And when you go to like conferences and stuff, you'll see similar things. And I just encourage you, as you plan, I hope you plan to get some of these. And I'm not like getting any kind of kickback by saying that. It'd be wonderful if I did, but no. This is really the only kind you should get. So they have other ones that kind of like go on top of your head. They have ones that aren't custom fit, that are just kind of like, basically one size fits all. In fact, everybody at my practice loves Francine so much, and they're always asking to borrow her, which is fine, but just sometimes, it's not practical. So the practice went ahead and purchased one of the, just kind of a generic one. I can't remember the brand. And it looks similar, but it's because, number one, the light source isn't as strong. This is like, I don't even know what 4,500 foot candles is, but it's really bright. And then the magnification, and because it's fitted for my eyes, so I basically had the sales rep come out and he like measured between my eyes, and he said, just show me where you hold things, like when you're looking at them. So I just kind of hold, and he said, because there's muscle memory, like we all kind of have our different, point of focus or whatever. So I just kind of said, yep, this is kind of where I hold things. So he measured that, and so when I put these on, the point at which this magnified area is focused is where I'm most, that's just my natural, comfortable place to hold things. And so they're really effective when they're designed. They're also really expensive. So maybe make it a graduation gift, or put it on your wish list. I was able to do monthly payments for a while to get to be able to make that happen, but so worth it, so worth it. And it's not even just exotics. Of course, it's essential for exotics, but I really think all veterinarians, anyone doing dentistry or just working on little things is absolutely necessary. And it's got it's got this battery, which occasionally, and the battery actually lasts a long time, but eventually it goes out, and so there's a backup battery that is I've always got plugged in. So anytime I need to switch batteries, I've always got one ready to go. I think what else? Yeah, I just find it, I don't think I could practice without Francine, so big help. Any questions on Francine? Yes. I needed a name. I was so tired of just asking my technician, can you go get my thing, like the thing that magnifies, it just needs a name. Go get Francine, and that's so it's been ever since then. So the next thing I was going to talk about is just how you need to have a certain willingness and openness to doing things that you've never done before. And I love this quote by Pablo Picasso. I'm constantly doing that which I cannot do in order that I may learn how to do it. And I think that kind of sums up veterinary medicine in general. But because our patients are, they're unique. And unlike, dogs and cats where there's maybe a larger population size and we know, which pain medications work in dogs and how they metabolize that and how they do or what to do if they, get a cut or a fracture or thyroid disease. We have all that information. We don't have all that information for all our many different exotics. And I'm always reminding clients and students who come through, with the parrots, and this, again, I'm a huge bird nerd, but they aren't different breeds of parrots, they're different species of parrots. So you can't necessarily say, even among the Amazons, they have their own little, niche. And so there's just a lot we don't know about individual species, how they metabolize things, how they handle various treatments. And so we have to kind of enter into our practice with an open mind and willingness to try things. This is actually an example. I love spaying and neutering little critters. This is the one and only ferret I have ever spayed. And it's not anything super unique. It's got all the same anatomy, but I'm going to guess, and maybe I shouldn't assume, that everybody in here kind of knows that basically all the ferrets that people have as pets you get, from a pet store, and they're already spayed and neutered. So to spay a ferret is an extremely rare occurrence. This particular one, you can kind of see in the upper right-hand corner, you can kind of see her vulva was huge. And we knew for a fact, she came from some kind of rescue or hoarding situation. We knew for a fact that she never was spayed. She was not from a pet store. So that cut down my, need for diagnostics tremendously. And so, again, I guess I take for granted a little bit that, but maybe I should just spell out too that, so in a female ferret, if they're not spayed, when they come into heat, they don't go out of heat until they're bred. And she was not going to get bred. So they can actually develop hypoplastic anemia, and they can basically become so anemic that they die just from being in estrus. So it's vitally important to get them spayed. So just saying, okay, well, I've never spayed a ferret before, but I've spayed other things. All the anatomy is the same. And lo and behold, it was not, it was not scary. Everything went perfectly fine. So that's an easy example, I think, of doing something you've never done before. This is a little bit maybe of a case. I'm going to try to share some cases. And I think, again, the challenge with exotics is you may have the way you're trained to approach a problem. So it got a hamster that comes in for these sores and hair loss. And, what could it be? Is it a skin infection? Is it mites? Is it trauma from another hamster? These are the kind of our differentials that we should be thinking. Is it trauma, infectious? And so you're thinking about your database. The problem is often with these guys, the owner can't spend the money on all the diagnostics that we know are the right thing to do. Fortunately, in this patient, she was willing to pay to have me do some diagnostics so I could do a full workup. And I think I actually did not do, I think the hamster was probably close to 2 years old. And in hamsters that basically have a lifespan of about 2 years, cancer is pretty much always going to be at the top of my list, especially if the hamster was previously normal, pretty much its whole life. These are, it doesn't live with another hamster. No one's picking on it. not itching. So I went straight, I kind of skipped over maybe some other recommended diagnostics and just said, we need to do a biopsy. We have to get a biopsy to figure out what this is. And so, put under anesthesia, get a little sample, send it into, and actually I didn't put this in my presentation, but using a lab that is familiar with exotics makes such a difference. And I've learned that the hard way multiple times. I think I would learn my lesson, but use a lab that is familiar with exotics. So I sent this to Avian and Exotic Lab. I think they use, I actually don't remember, but they use a pathologist who is, very familiar, and so it came back as cutaneous lymphoma. Not good news for the hamster, not a huge surprise, but so satisfying as a veterinarian to be able to work up a case, get an answer, and feel that, okay, I am making the correct recommendation to have the pet euthanized with that information. Got some more fun pictures, just various fun things here. So the big picture here is a fox turtle, and I don't know, would it help if I turned off some of the lights here? Would that,
Yes.
I don't know. I see a little better. I was gonna say I'm gonna act like I know what I'm doing, but I don't know.
Okay.
That's better. See a little better. So this is Yuri, the box turtle. Yuri was a school pet, and he wasn't eating really good. So I think over the course of, I guess I'm a little foggy on all the details, but took some x-rays, we need to get nutrition into him, and it's a little hard to syringe feed a turtle. Like, either they're gonna cooperate or they're not. Most of them are not going to just let you, they can really pull their little heads in so tight. So we need to place a feeding tube. So this is post-op. I think he's still, I'm thinking that must be my, I think if we just took him off anesthesia or something, so he's probably still got a little breathing tube in. And then the big orange tube on top, of course, is his actual feeding tube. And then we syringe feed the critical care. Never done that before, but I know how to place the feeding tube in other animals. And, same principles. You can always look up, either on VIN or in, one of the resources. And of course, I now have all my stuff in Evernote about placing a feeding tube in these guys. The top picture, top right picture. Number one, can anyone guess the species? Oh, sorry. All right, it's a leopard gecko. Yeah, I kind of cheated there. Okay. So I was going to ask if you know what those structures are that are sticking out. Those are the hemipenes. So in male leopard geckos, they have little hemipenes. And they're not usually sticking out like that. They're tucked in. So that's a prolapse. And, just if you see something like that, your inclination is to put it back in. And that is a good inclination. So it's just been, trying to get them in. So lots of lubricant and just very gentle and patient. And, I don't think that's anything anyone can really teach you. It's like you gotta, if you're faced with something like that, okay, those need to go back in. And you just try to get them back in. And as I recall, I got them back in, they stayed in, and I don't think he had any further problems. The bottom one there, so it's a little hard to see, the orientation's a little weird. This is a guinea pig laying on his back, and this big, huge thing is an abscess. It turned out to be a sterile abscess. And again, just having the owner willing to do the diagnostics, that I was able to culture it and able to do the surgical debridement is kind of more than half the battle sometimes. But just being, taking all your principles that you learn from all the other, wound management and how you would do this if it were a dog or cat, and try to adapt that. But creativity is so key, and I think I've got some more slides on, okay. This was a really cool case. Unfortunately, did not end well for the tortoise. This is a sulcata tortoise on her back. So this is the trach tube going in there. And she had a bladder stone. Unfortunately, she was so sick by the time she got brought to us, and we did the surgery, which was, involves a Dremel saw in, cutting open that plaster on that shell and getting in there, and then the stone itself. I mean, she's a pretty good sized tortoise, but that bladder stone, I've still got it. It's huge, and just even trying to get it out took muscle and a lot of swearing, but we got it. Unfortunately, she never woke up. She was so sick. I think when I sent her blood work in, I'd never seen this note before. Other than just like listing all the things that were wrong with this tortoise's blood work, the comment was very serious blood picture. I'm like, what does that even mean? But it just sounds really bad, like serious blood picture. She's just the pathologist was saying it's not good. So yeah, she did not make it. So I'll try to maybe move through a little faster. Necropsies. This is going to be one of the best ways that you can learn about exotics. This actually is that box turtle that you saw in the previous picture. It ultimately, I think he had sepsis, and unfortunately, did not make it. So, I kind of ironically put the turtle picture up here as necropsies for free, because turtle necropsies are not easy. You have to, that's my Dremel saw. So I do offer all my clients, I tell them, if whatever you have, little exotic pet, passes away, I will do a necropsy at no charge. Turtles are an exception because they're so much work. I will have to charge for that. But I find if I can just take, and maybe I don't do the most thorough, with the whole necropsy procedure that they teach you in school. I'm kind of looking for something obvious. I'm trying to familiarize myself with the anatomy. And that's how you get to know things like, the little, like in guinea pigs, a male guinea pig has these little seminal vesicle things that if you didn't know that those were normal, you could think, oh my gosh, is this a hermaphrodite? These look so strange. What the heck is this? Or, that rabbits have a really tiny little spleen. And instead of thinking, oh my gosh, the poor rabbit, its spleen was so underdeveloped, it obviously, was just, it had a poor immune system or something. No, rabbits just have a tiny little spleen. So I've got some other pictures. I think this is the fox turtle, and I think the liver was modeled, and some septicemia in the fox turtle. My ferret up there is such a sad case, but you can see how emaciated that ferret is. I mean, those are literally the ribs that you can see, and then just this belly full of fluid. And so it's just killing me to know why was that ferret so sick. And so got some samples, and I can't remember actually what kind of neoplasia it had. I want to say lymphoma, but I can't remember, something. And then this case, this bearded dragon down here, such a cool case, and I keep telling myself I'll get it written up, and I haven't yet. But so this is a young bearded dragon, maybe not even 2 years old. Very, very beloved bearded dragon. I mean, she would have done anything in the world for this beard. And I mean, we did all kinds of, he had this big neck mass, and he had trouble swallowing. And I read on Vin, neck mass, bearded dragon, everyone talks about an aneurysm. So I was like, I don't know, I think maybe it's an aneurysm, and there's not really any treatment for it, but I got maybe some cytology. I can't remember. I think ultimately we either euthanized him. Yeah, I think we euthanized him. But the owner let me get a blood sample right before I euthanized him and do a necropsy. So it turns out that whole big thing that's kind of just above that blade there is a thyroid mass. And again, using my exotic pathologist, this was a goiter. And there's like no reports of a goiter in a bearded dragon. And really, I mean, like you can read about, goiters in reptiles. The big one that comes up is maybe some kind of tortoise, one of those big tortoise. And so anyway, and it turns out the owner, because she was so meticulous, she kept a list of everything she fed that bearded dragon, and a lot of the things she fed this guy were what would be considered maybe goitrogenic foods. I have that in my Evernote, the whole list of everything she fed. So when I eventually do get to write up that case, I've got all that information. This is an iguana that never woke up from surgery. That's the cecum. So iguanas, are they have a big cecum, and you can see like how gas filled that is. And this is like pretty much. I did the necropsy shortly after he died or she died. So it's not like this is I wouldn't call this like a post-mortem change. I feel like she had ileus, like she just was or like kind of like a horse would colic. I mean, just huge gas-filled cecum, and I'm sure it was very painful. And she never woke up. The surgery she had, I think she had like a cloacal prolapse or something. So I wasn't in her abdomen, and I had no idea that was going on, but that definitely killed her. Oh shoot, so one of the most important topics, emotional dexterity, and I'm probably not allowing enough time. But there's this great video, maybe I'll play it at the end. I think this is a video that everyone in the veterinary profession should see. Brene Brown is this, she's a social worker, and she's done TED Talks, and so I think any profession that requires a great deal of compassion, there's the risk of compassion fatigue. And what her big thing in this video is, if you don't set boundaries for yourself, you can just really deplete your emotional reserves, and then you can't take care of anybody. So she said compassion without boundaries isn't compassion. And it's about a 5-minute video, so I think I might just go past it right now. Oh yeah, that'd be great. Yeah, good idea. But the point that kind of like leads me to it is this case, which was one of the most emotionally challenging cases I've ever had to deal with from the standpoint of the owner. So this is a green tree python, and it takes a special person to have a green tree python as a pet. And she had numerous snakes. Try to give the short version. Basically, she rescued him from a previous owner. And I feel like she was very intuitive with this snake. Like I trusted her in terms of like, when she said something was wrong, then I knew something was wrong. But ultimately, I think, like, long story short, he died. And we had a lot of fun with him. It was a pretty cool green tree python. And so he died, and she absolutely flipped out. And I'm trying to help her figure out why her snake died, and I recommend doing a necropsy. And basically, she did allow me. She said, "Okay, do the necropsy." So I did the necropsy, and I did tell her I was going to collect some samples. And so I collected some samples, and then so I call her to tell her that he's ready to be picked up. She wants to take him home for burial, and she asked me very specifically, did I take his heart? Of all the samples I took, did I take his heart? Yes, I took the heart because of, what? I mean, she screamed, absolutely just, I don't think I've ever been yelled at so much as by this client. And it was, it was just kind of, yeah, it was difficult. And so what we ultimately did, because I had saved several samples, I had taken like little pieces of the heart, and some of it I put in formalin, some of it I saved in saline, and like I was bound and determined, like I'm going to figure out what the snake died of. Even if I just have to pay for all the diagnostics, I want to know what the snake died of. So I was able to get a little piece of the heart from the saline, put it back in the snake, and sew him up, and so she could take him home for burial, because she could not bury him if he didn't have his heart. And it's just, I think a reminder that like you can't, and it even ties into kind of like some of my other themes, that like, be prepared for the unexpected. You think you're communicating well, and then there's just maybe a big assumption that took place that you didn't even realize you were making this assumption. So having the emotional dexterity to be absolutely screamed at by a client. And I mean, she came in, she made a scene. We put her in a room. Everybody in the whole hospital could hear her screaming at us. And, and just feeling like, that you can move on from that. And these are actually the little clay paw prints. We do clay paw prints. We took his little tail and made like a little heart. And it was actually really cool. So I love this quote, some people grumble that roses have thorns. I'm grateful that thorns have roses. So I think it just ties in, celebrate success, because you got to enjoy the good stuff. Take lots of pictures, enjoy the beautiful patients that we have, and let your technicians enjoy them. Like take pictures of them, because they love, enjoying all that too. And it helps with all those rough times that we have as well. And then, of course, expect the unexpected. You may have just, what appears to be just a perfectly cute little sun conure, but that's the rest of it. Anyway, these are just some other little fun things I thought might be kind of like fun to discuss if we had time, but certainly happy to take any questions. One of my favorite little quotes by Dr. Seuss: if you never did it, you should. These things are fun, and fun is good. Thank you very much.
Are there any questions?
Yeah, so if you are looking to apply, if you're looking to apply for jobs as like a fresh graduate, and you're interested in practicing exotics, maybe at a clinic that doesn't do exotics, what's the best way to prepare for that, or to show them?
That's like a whole. I like that. That's like a whole nother presentation. Because I have a list of things that you should have. Like Francine would be a perfect example. Needing to have a gram scale. Preferably one that has a little perch that you can adapt to it, and maybe a cordless Dremel, so you can do like beak and toenails, wing trimming scissors, some of the endotracheal tubes that are specifically for birds. They're non-cuffed, and they come in a variety of different sizes. So I think depending on how much you want how much the practice can purchase, it can be done on I think a fairly limited budget. One really important thing though is think about the exam room, because some hospitals have these really beautiful exam rooms. It's fine for dogs and cats. Vaulted ceilings that go up like 10, 15 feet. You don't want to be doing birds in those rooms. or places that have like little, and ferrets will find any little, if there's a little hole in the wall or the cabinet, they will find it. Or if the space between the door and the floor is just big enough for a little critter to slip out. And try to think about the exam room and where are going to be my problem areas. But yeah, I would love to do a whole separate presentation on how to get, introduce that. I have a list of stuff, so maybe I could send you some stuff to put on your page.
Okay, if there's no more questions, thank you guys for coming out tonight. We really appreciate it.
opportunity to come talk.
As you guys are meeting, if there's anybody that you wanted to do preparing training and didn't get the chance to, can you come talk to Dave or I